I've had a number of occasions to use emergency services with issues that I've had with my son. It has led me to have a lot of dealings with law enforcement. It's led to a number of hospitalizations and in particular a lot of emergency room visits. But there have been other situations less severe where I haven't known quite what to do with him. It isn't appropriate that he go to the emergency room. And yet that's the only option. I can't take him to the clinic and have a sense that they will understand what the issue is and have any capacity to deal with it.
So the Mental Health Crisis Alliance found that people weren't getting the right care at the right time and really wanted to put in a different level of care into the mental health crisis system. And the urgent care is the right level of care at the right time for people experiencing a mental health crisis.
When a person comes to urgent care, they're walking into a very intentionally warm and welcoming environment. They're going to be greeted quickly, and they're going to be connected quickly with a nurse or a social worker who's going to sit down with them, reassure them that we're here to provide support to them, and work with them on a plan to assist them with the crisis they're currently experiencing.
Urgent care provides an array of crisis services, starting as something as simple as supportive phone counseling to connecting people to peer recovery specialists, providing crisis assessment and stabilization services. We'll connect people to crisis residential if that's what they need. It might also be that we provide information referral services. If people don't have a therapist, if people don't have a psychiatrist, we'll get them connected to the right person.
People living with mental illness are not their diagnosis. They are not bipolar or schizophrenic. They have bipolar illness or schizophrenia or depression, just like people with cancer are not cancer. They have cancer, and it's so important that people know that they can and do recover from their mental health challenges. And this is a very supportive, non-judgmental, strength-based, recovery-oriented environment. And we really are focused on taking the stigma out of mental illness. As someone that's had mental health challenges and has been in crisis, this is just such a wonderful, new and innovative place to be able to work and to be able to support the people that are coming in. As peer support, we're here to help empower people on their road to recovery.
We are working with all of these great partners to change the system, and it isn't coming from federal health care reform, it's not coming from mandates, it's coming from people who genuinely would like to improve care for people with mental illness.
It's really nice to know that there's a place like the Urgent Care Center that could effectively kind of look at my son really early on, have the capacity to understand what's going on with him, and a right level of care and the right treatment might be available to him to get things back to normal sooner.
Urgent Care for Adult Mental Health is located at 402 University Avenue East in St. Paul, just north of downtown St. Paul and east of Interstate 35E. Walk-in visitors are welcome, no appointment necessary. Phone support is available 24/7. Services for adults ages 18 and older include crisis assessment, crisis stabilization, rapid access and gap psychiatry, peer support, 24/7 phone support, referral to community resources, and follow-up services to further aid recovery. Ramsey, Dakota, and Washington counties have mobile crisis teams that can meet people at locations of their choice. Services are offered regardless of ability to pay, but the Urgent Care will bill insurance providers when available. Urgent Care hours and more information is available at mentalhealthcrisisalliance.org or call 651-266-7900.